type 2 diabetes is a problem. And, you know, we're doing our best to play a part in solving that, not just with medicines, quite frankly, with Fit2Me, which is, you know, a sort of nutrition, recipe, exercise support, educational platform we put together. We had over 1 million people visit it last year. Over 1 million people in the United States logged on to see, how can I get help, what do I need, how can I take more responsibility, and we put that out there as well as an important part of the things that we need to do. And, you know, we're proud of that association, but also, you know, we recognize that we need to be here, be active, you know, be open, be listening, and be proud of the data that we're sharing. What we tried to do, there's an awful lot of education that goes on, and again, I think something, you know, we're proud of as a company, that we invest a huge amount of our resources in facilitating a conversation for patients to go, who are motivated or curious to go and get great advice. Log on, get advice, take a look, get recipes, get exercise, get connected to other patients, get support, get coached. And, you know, we've reached quite an important stage, I think, as an industry and as consumers now, with the digitization of everything, with the snackable nature of online content. You know, it's feeds now. It used to be websites, but now it's picking and choosing from data feeds and streams. It's how do we engage with patients to make sure that they're getting just the right amount of information, to remind them of why it's important that they look at lifestyle and take their meds to get the best possible outcome. And we're being encouraged by payers, quite frankly, to bring forward, and providers to bring forward, these educational and support services equally with bringing forward our medicines, because I think everybody understands how difficult this is. I think we've reached the stage where there are the right mechanisms in play. I think because, you know, it's only the last 2 or 3 years that we've come on the back of SGLT2 and a further understanding of GLP-1. It's a little bit further back for DPP-4s, but I think we're saying we have the mechanisms. I'm not sure we're at a stage where everybody fully understands the right patient profile and the right combination of the mechanisms, and we all play our part in that. But I think the educational piece, both healthcare professional to healthcare professional, as to patients, patients to patients, I think that is proliferating at a huge rate, and is probably reflective of how much information people are trying to take on, what they're trying to understand about their own disease, and then how can they get the best outcome. It is very individualized. And you know, if I take anything away from this meeting, it's the individualized nature of care, which means, fortunately or unfortunately, there's a huge amount of responsibility on us and our peer group to make sure we bring the right level of information forward. You know, 5, 10, 15 years, I think at 15, you've kindly given me an opportunity to think, I'd love to see a cure. I'd love to see us, being able to offer something, whether it's through genetic sequencing or whether it's through monoclonal antibodies, working on not just on reducing HbA1c, but significant and dramatic weight loss, and also cardiovascular outcomes. You know, I can see bi and trispecific antibodies covering all 3 of those things 10, 15 years out, and maybe even sooner than that, quite frankly. So I think we have the aspiration of delivering on let's not just treat the symptoms, let's get much deeper into beta cell regeneration, let's look at what that would look like, and, you know, change the course of the disease, and dare I say it, we would all love to be in a position where it could be reversed. You know, we'll play our part in that. We expect to be a leader in this therapeutic area by the end of the decade, and, you know, those things will be part of that conversation.